Now, as a therapist, what I do is I assess people who come to me. They come to me because their lives aren't working. They're stuck in some way. They're stuck in their careers. They're having addiction issues of some kind. Their relationships aren't working. They're getting divorced for the third time. Their children are giving them a lot of trouble, whatever it is. So they come to me and they want help. So the first thing I do is I do a thorough assessment to find out where in their lives were they traumatized. And because I'm looking for that. So then what I do is I go in with my specific set of techniques, and we actually go back in and relive those traumas that he went through, but give his brain, the cool thing about the brain, I just love the brain. The brain has this great quality called plasticity. And because of plasticity of the brain, you can convince the brain, this is how brainwashing works actually, you can convince the brain that something different happened in the past.
Really?
Yes, because all we have are our memories.
God.
So you can go in there, and this is the person empowering themselves. So I'll say, well, what would you like to have had happened? What would you like to believe? And we go back in and we process and reprogram the information into the brain the way they'd like it to be. And it sounds like stupid, like how could this possibly work?
Right.
But it does. And eventually, it can take months to do it if it's a really, really, really big trauma.
Yeah,
but once they're done, they're done.
Compared to years.
Compared to years
of
being in this phobia, whatever, or addiction or whatever it is. Yeah. So I love what I do. I'm thrilled to be a therapist and to actually not just wade around in the muck of people's problems, which is what to me talk therapy is. I'm not a talk therapist, but to actually have people come in, tell me how disturbed they are. We measure how disturbed they are. So it might be a 9 out of 10 for how disturbed they are. And then we do this process, and by the end of it, we remeasure, and the disturbance is gone. And when we've worked through all of their disturbances, they graduate and they're ready to go. And you can tell because they've actually healed.
Yeah.
So that's so much more gratifying for me than the old way that I used to do therapy, where it was just kind of like listening to problems and not feeling like they ever really, they might feel a little better, but they weren't healing.
Yeah.
And this process actually heals them.